Is this you? Are people keeping an additional 5 meters COVID distance? Does your age, medical history, genetics affect how your body reacts to the flu infection? Watch to the end for the answer, which will be of great benefit to you. In this video we will discuss what happens to your body when you have flu. The number of Americans who contract the influenza virus each year ranges from 5 to 20%. Up to 50,000 of these individuals will pass away, and an average of 200,000 will need hospitalization. Since the immune system deteriorates with age, those over 65 are particularly vulnerable to influenza infection. Furthermore, older people are more likely to experience long-term disability after contracting influenza, particularly if they are hospitalized. Please note, this video is for educational purposes and must not be perceived as medical advice. Please refer any medical questions to your doctor. Flu symptoms. Health officials claim that the symptoms, which frequently appear abruptly, include a fever, cough, sore throat, and runny nose. Muscle discomfort, headaches, and exhaustion may also be present in sufferers. Although more frequent in children, vomiting and diarrhea are also possible. A person's health status plays a role in how the symptoms present themselves in the body. Their immune response and the virulence, or strength, of the virus to harm its host can be affected by factors like age, previous infection history, genetics and lifestyle choices, including smoking. What happens to your body when you have flu? Influenza must enter the body in order to start acting. When an infected individual coughs, sneezes, or talks, liquid droplets are released into the air, carrying the viruses that cause the illness. Even if someone is up to 6 feet away, these still end up in their mouths or nostrils. Rarely, if a person touches something contaminated with the flu virus and then touches their mouth, nose, or eyes, they may contract the illness. The virus then travels to the respiratory tract and attaches to the cells lining the airways. Once it is within the cells, it multiplies and grows. The virus then leaves the cell and infects additional cells, causing an immune response. Many flu symptoms are caused by this intricate system of chemical defenses. The lungs are among the higher and lower airways that the virus targets. Because of this, persons who have the flu frequently feel worse than those who only have a cold. Pneumonia can be brought on by the virus if it gets into your lower airways and lungs. In rare cases, people can even get bacterial pneumonia as a result of the flu, but this isn't common and is more likely to happen in people who already have a medical condition or who are very young, very old, or are pregnant. There may be further issues. The best natural defense your body has against the flu is inflammation, but too much inflammation can cause even more serious issues, such as a heart attack, direct heart damage, or even encephalitis. Finally, does your age, medical history, or genetics affect how your body reacts to the flu infection? The answer is yes. The U.S. Center for Disease Control and Prevention cautions that some people are more prone to experience complications that require hospitalization and may even be fatal. Young children, youngsters with neurological problems, persons 65 and older, diabetics, and pregnant women are some of those. Additionally, those who have cancer, HIV/AIDS, or cardiovascular issues are at a higher risk. Obese people with a body mass index, BMI, of 40 or more have an increased risk of flu complications. People who live or work in facilities with many other residents, such as nursing homes or military barracks, are more likely to develop the flu. People who are staying in the hospital also are at higher risk. In summary, every 6-month-old and older should get an annual flu shot, according to the Center for Disease Control and Prevention. Your risk of contracting the flu, experiencing its full severity, and developing a serious illness that necessitates hospitalization can all be decreased with the help of the flu vaccine. Avoid touching your eyes, nose, or mouth, because doing so might transfer germs. Put on a mask. Wash your hands with soap and water frequently. In the absence of soap and water, you can also use an alcohol-based hand sanitizer. By avoiding people, if you are ill, you can prevent others from contracting the flu. For more interesting and educational videos as these, please like, share and subscribe.